reservation. I made it for 7 p.m. at Carmine's. All right, I'll meet you there after work. All right, love you. Is it Kyle?
Yep.
Oh, what's going on? I got
How's it
your
going?
email. You're filming the day in the life, right?
Yep.
All right, great. We're gonna have a lot of fun today. My name is Joe. Right, so I'm gonna be one of the OTs that you're gonna follow around. It's also gonna be Chris and Allie. They might be actually pulling up real soon. Well, welcome to Mama's General. All right, and once everybody gets in, we'll get started, and I'll kind of show you around. All right.
Sounds good.
All right.
So did you get the new cold brew from Dunkin'?
I did.
Yeah?
It was really good. How about you?
I had it last week.
Oh, yeah?
Mm.
Another ad up there?
Oh my god, I swear, every single week there's a new ad for this hospital.
Oh, my God.
Not a bad thing, but
No, it looks good, though.
it looks great.
I like it.
Go, Kyle.
Sorry.
All right, are you ready? Ready to get started for today?
Yep.
All right, you gotta let me know that you're there. You're kind of scared me a
Oh,
little bit.
sorry, bud.
All right. All right, so I got your email, Kyle. I saw that you put a couple questions in there for me, just to give you a rundown of kind of what we're gonna be like. So the setting that we're in is an inpatient acute care in the hospital, of course. Who's in the setting? So it's gonna be us, some of the OMTs. There's gonna be some SLPs, some nurses, some physicians, right? Because anyone that you would really think would be in a hospital, case managers. Our common work hours, I'm usually 8:30 to 4:30 Monday through Thursday, and then 8 to 4 on Fridays. No weekends, right? Because we don't do therapy on the weekends. Some common diagnosis, it's hard to kind of say the common diagnosis because it is so broad. We could see everything from Parkinson's to heart attack to total hip replacement, stroke. And it's very broad with that, and it's also, across the lifespan. So it's not just older adults we're gonna see kids, all the way down to babies. Length of stay, very quick, usually within a week, 2-3 days. Responsibility of me, I kind of oversee everything because I am the rehab manager. In terms of supervision, because of my experience and the amount of hours that I worked, I am able to supervise an OTA, which is an OT assistant, and even some fieldwork students. However, just a total between the two, it can't be more than 7 at one time. All right, so we'll get started, all right? All right, so our first patient that we're going to see today, her name is Allie. She's 24 years old, and she's with us today because she suffered from a TBI causing some right-sided weakness and some cognitive issues. Basically, our plan for today is kind of just talk to her, see how she's doing, and also hopefully try to get her work on some of the transfer skills and get her up and moving to the wheelchair. All right, so you can follow me. We'll come in. All right, hey Allie, how are we doing today?
Good.
Doing good? All right, so we have a very special day because my friend Kyle, cameraman over here, he's going to be doing a little documentary on me. So if it's okay with you, he's just going to be filming just me. Is that okay?
Sure.
All right, good. All right, so first I'm just going to kind of, wash my hands really quick, and then we'll get to going with our session, all right?
Cool.
So as you saw, the first thing was I kind of talked to the patient, see how she's doing, kind of explain, confidentiality, kind of who you are, and then I'm going to move to kind of washing my hands after that. And then once we kind of get through this, we are going to start our session. All right, so our plan today for Allie is first I'm going to kind of, just talk to her first, see how she's feeling, obviously. I'm then going to move to putting a gait belt on her, right? Because we're going to be moving around. So first things first, I'm going to put a gait belt on. And then I'm going to assess her vitals, make sure her vitals are kind of in that proper range for her to be moved around a little bit, kind of get the heart rate going. And then once we have that, we're going to kind of see how well she's able to transfer herself up from the bed. Following that, we are going to actually do the transfer to the wheelchair. And my assistance is going to kind of depend on how well she's kind of doing that. All right, so you follow me. All right, so hi Allie, how are we doing today?
Good.
Doing good. All right, so today what we're planning on doing is we're gonna kind of work on that transfer stuff, see how well you're able to kind of transfer yourself, okay?
Okay.
All right, before we do that, as always, we gotta put on our very fashionable seatbelt, right?
Yeah.
All right. So how's your day been going so far?
Boring.
Boring?
Yeah.
A lot of people come in your room in and out?
So many.
Yeah.
Yeah. I
Well.
had PT earlier. The nurse is always checking up on me. And I think I have speech later.
Okay.
Yeah.
Well, hopefully I'll be your favorite visitor of the
I
day.
hope so.
All right? All right. So we're gonna put this seatbelt on here, right? It's gonna come right under your back,
Okay.
okay? Go. How was PT today when you went and saw PT?
A little tiring.
Yeah?
Yeah.
Good. What'd you guys do?
We tried getting up as well out of bed. They had me stand up for a while.
Oh, yeah?
Yeah, without the wheelchair.
All right, can we try to pull this up
Yeah.
a little bit? And how did you do when you were trying to stand up?
Not really good.
Not good?
No,
Did you get a little tired?
really tired.
How are we feeling with that right side?
The same,
Same thing?
just weak.
All right, so your blood pressure was 116/82. All right, and then put your arm out for me one time. Perfect, just like that. All right. All right. So all falls in the range that we are gonna do some moving around today, okay?
Okay,
All right, and if you get tired at all or we feel a little dizzy, what do we do?
stop.
We stop and what do you tell me?
I need to stop.
You need to stop, right? Alright, so first I actually want to see how well we are able to kind of get ourselves up, okay? I
Okay.
know your right side is the weak side,
Yeah.
right? But I want to see how well you're able to come, you know, towards me and kind of get over to this
Okay.
side with just our feet on the ground,
Okay.
okay?
Yeah. Should I try?
Yep. Kind of scooch over as much as you can. Good. You can keep coming. All right, we're gonna push off.
Like.
There we go. Good.
Okay.
Very good. All right. I like it. How do you feel?
Okay.
Okay. A little tired.
Little.
So now we're gonna come over to here, right?
Okay.
All right. So I'm gonna come in. All right. I'm gonna move you kind of a little bit towards me.
Okay.
Okay. All right. So you kind of put your arms right on my shoulders. Thank you. Ready? And then count of three. I'm gonna come push you towards me. All right.
Okay.
1, 2, 3. Good. All right. A little more so we get those feet on the ground. 1, 2, 3. Good. All right. How do we feel?
Good.
Feel all right?
Yeah.
All right. So when we come up, I want you to put your arms on my shoulders again, all right? I'm
Okay.
gonna count on my 3. We're gonna come up. We're gonna take probably like 1 step back towards me, and then we're gonna start taking steps on my count towards the chair, okay?
Okay.
Does that make sense?
Yeah.
All right. All right, so hands on my shoulders. You can put this one up.
Okay.
There we go. All right, ready? Count 1, 2, 3, up. All right, take 1 step towards me. Good, all right, now let's take a couple steps back. 1, 2, 3, good. All right, now we're gonna come backwards, and when we come back, I want you to reach down for the arms of the chair, okay?
Okay.
All right, there we go. So 1, 2, 3. There we go. All right. you guys probably doing the same as me, just taking a
Yeah.
little break.
Yeah.
Long day.
How's your
Oh
day
my
going?
God. All right. It's a little better than last week.
Oh my
You
god.
remember that?
Don't even get me started.
Oh my
I mean,
God.
I really thought you guys
Bad.
were gonna take your heads off.
I
Yeah,
know.
but thank God you stopped over
We
there.
were really going at each other. I'm just happy I was there to kind of step in.
Yeah.
Me too.
You know, give you guys that conflict resolution.
I was getting a little tense over there, but you stepped in.
Yeah, of course.
Okay.
That's what I'm here for.
Yeah.
Right? If you guys ever need me, you let me know.
You
Got
got it.
it.
Thanks.
Okay, so today I'm seeing my client Chris. He's 24 years old. He had a right CVA, so he has left-sided hemiplegia. So I met with him yesterday just to go through the occupational profile, gather some information about him. Today, what we're doing is sensation testing on his left side, just to get a grasp at where we're at with sensation and stuff. So let's go see him now. Hi, Chris.
Hi, how are you?
How are you today?
I'm good.
Good. So I know yesterday I met you for the first time, right?
Yep.
And I just got some background information about you. So today all I'm gonna be doing is sensation testing on your left side. Is that okay?
Yeah.
Okay. So I'm gonna flip your arm over. So I'm gonna use the tip of this pen cap and I'm gonna poke, just not hard. It's gonna feel like that, okay?
Mm-hmm.
Give me your right hand. This is what it feels like.
Okay.
Okay? So when you feel that, anytime here, I want you to say yes, okay?
Okay.
All right.
A little bit there.
Right here.
A little bit.
Okay.
A little bit.
Okay.
A little bit, yeah.
Okay, good. Okay, so I'm just gonna document what we just did, and your chart.
Can I see the chart?
Actually, we can't just hand you your chart, just because of policies and procedures in the hospital. It's just some safeguards that we take. If you wanted to see stuff in your chart that was documented, we can definitely set something up and arrange that for you to talk with somebody about the information that was written down.
Okay. All right, this is Mr. Soprano over here. He currently has a total hip replacement on the right side, and he's getting ready for discharge. And now we're just gonna do a couple outcome measures to see if he's ready to go home. How's it going, Tony?
Doing all right.
Are you good?
All right, yeah. Getting ready to. What are we doing here today?
I'm just gonna do a couple of walking ways. Like I'm gonna have you walking over there and then back, and then seeing if you're ready to go home. Because I know you've been seeing the OTA, right?
Yes, I have.
And they've been working on the right protocol while dealing with your right
Yep.
hip, right?
I think he was telling me I gotta make sure not to bring my leg in. I think he said something like baby duck, right?
Yeah.
Can't bring my leg inward, and also not to bend at my hip about 90 degrees, right?
Good, yeah. And then right now you're in the chair, right? How would you be getting up right now? How did they teach you to do that?
Well, he told me to make sure that my hip doesn't get to that 90 degrees. So this
Mhm.
is the one that, I had to get replaced. So he told me to kind of keep my foot out with my heel on the ground for this one, and then kind of just push off the chair with it, and then onto here.
Good, good. All right. You want to do it right now for me? Want to give it a try for me?
Yeah, absolutely. Am I
Sure.
gonna go down to
We're gonna start here, and then gonna walk right there by the orange line, and then turn around, and then come back here, and then have a seat, all right?
All right, are you gonna time me?
I'm gonna time you, yep.
All right. You tell me when to go.
Ready, set, go. Lead with your left foot, and then follow with your right, all right? Take your time, be safe.
I'm a rock star.
It's all you right now, all right?
Sure, you've never seen nobody go this fast.
Yeah? We're doing good so far.
Carmelo would be proud of me.
Good, good. And your kids, right?
Oh my God, Christopher, Meadow.
The best. Fast and slow. After this, might be going home, have some nice food, home cooked food.
Oh, of course. Only me the best for Mr. Soprano.
Of course. A good job leading with your left and following with your right.
Right, here we
And
go.
then follow this way. Perfect, perfect, perfect. And then leg out. Oh, the right leg out. Remember that?
There we go, right, you're right,
Good,
dog.
good, good.
Thank you.
Perfect, perfect.
Pretty fast, right?
Yeah. Ain't nothing like it.
All right. Hey, Chris. So how do you think that session went with Mr. Soprano?
It went pretty well. He has the diagnosis with his hip, and it isn't expected that he's gonna be, fully ready now to go home. So, based on what we saw, he's gonna be referred to acute care, and then he's gonna be there for however long it takes to reach his goals. He's gonna still work on the same things he's doing here, but over here we only have them for 2 to 3 days, and then from here he goes there and then works on everything else. So based on that, he's gonna be there for a little while working on his walking, his ADLs, and everything else, and then from there they'll assess. It's out of our hands now.
And so can you talk to me a little bit about how you kind of do discharging here at the hospital at Monmouth General?
The discharge really starts the second I see each patient. As I'm thinking their goals, I'm assessing them. I think about what goals they have to meet in order to be discharged from here. So this client right here, Tony, he really needed to be able to independently transfer from the bed or chair to the walker and then be able to walk very short distances. And then once that's met, we then transfer them over to a different rehab facility to work on the other skills associated. So we're really quick here. We are focusing on what's important right now in order to help them in the future. And that's what we just did with Tony.
Perfect. Thank you.
Of course.
So where are we going now?
Now we have a performance appraisal with one of our OTs, Chris, who I think you guys have met.
Oh.
All right. Hey, Chris. All right, Chris. So today, basically, what we're gonna do, as you probably know, is gonna be your performance appraisal, right? So these things are annual and kind of, we meet once a year. We kind of go over the kind of those same things, kind of set a couple goals for ourselves for the next year. So basically, it's kind of what we're gonna do today.
Yeah.
Some 3 main things that we're gonna do is we're gonna talk about how, I've been kind of seeing you, kind of what from some of the patient satisfaction reports that come in, how we're looking there. I want to know how kind of you're viewing yourself, and then I'll give you some of my suggestions I have for you.
Yeah.
Sound like a plan?
Sounds good.
All right. So the first thing we're gonna go over is kind of from what I've been seeing, right? So first of all, I want to commend you on your client feedback, right? So you've been getting some great patient satisfaction reports, right? So some of the reports we have coming in, a lot of people love you, right? You've been doing great. I think your skills, your people skills have been off the charts. So I want to commend you on that. I love the energy that you bring in every day, right? You bring in make every Monday feel like a Friday in here, right? So I really want to commend you for that. I think that's awesome. All right. Like I was saying before, that patient satisfaction, people, they feel safe with you, right?
Mm-hmm.
They want you to be there for some of those times when they're not their best that we're gonna be seeing them. All right. So now you heard kind of how I feel.
Mm-hmm.
What I've been seeing. How's Chris viewing Chris?
I feel like I'm doing pretty good. I'm feeling pretty confident in how I'm treating my clients, how I'm working on my team, and just working as a whole. I feel like I'm incorporating a lot of things into my practice and just doing the best possible care for each client that comes in. So I feel like overall pretty good.
Good. I love hearing that. How do you think you're doing, taking feedback in, right? So accepting some feedback from others on the team.
I'm good taking the feedback. I'm good listening, hearing everyone out. But the part of implementing the change kind of takes some time.
Okay.
I feel like I'm stuck in my roots sometimes, going back to the main way of doing things over my past couple years here. So it's hard implementing that change that everyone else is telling me about.
Good, and I appreciate your honesty, obviously, in our conversation together. The last question I have for you, just kind of about how you're viewing yourself, is what is something you think you can improve, right?
I think my leadership, because I've been here for 5 years already. I think I can kind of move up and use my skills for the better, in the sense of moving up the leadership ladder here, and then kind of taking more OTs under my lens here, and then kind of working with them to improve the practice here.
Good. I love hearing that. I think that's a great idea. I could definitely see you kind of moving up that leadership ladder. All right. So some of my suggestions. So first of all, I kind of see your CEU progress. I think definitely, just make sure you're on top of that. Keep getting those CEUs for the year. Also, I know you in the past you expressed some interest in some of that lymphedema management, and just getting to know you. I think it'd be a great idea for you to go get that certification, kind of, go towards that professional development a little bit, and I think that would definitely help you in terms of your leadership as well. So I think we could definitely make a goal on that.
Sounds good, yeah.
All right, we like that plan?
Of course.
All right, I'll see you next year.
I see you.
Who else works here, Joe?
Oh, so here at Monmouth General, we have, actually, right here.
Did you guys
Hey
number
guys,
last night?
so we're actually filming a
we on
little day in the
camera?
life
Are we on
thing.
camera?
We
Hi,
actually
do I
are.
look boss like that?
Yeah, you look really good, babe.
Okay, so guys, this is Kyle. He's helping us film a day in the life
Hi,
Kyle.
Kyle.
At Monmouth General, right? So why don't you guys just introduce yourself really quick?
I'm Kayla, I'm SLP.
And I'm Nikki, I'm the nurse.
All right, and those are two of the professions that we often kind of see our work
We love Joe.
going in between with us.
Hey, Allie, what are you doing?
Hey Kyle, I'm just doing some documentation from my client from before. So when I'm with the client, I usually just write down my notes and the documentation that is needed, and then I'll also document everything electronically. That's called point of service, like when you do documentation right afterwards. So electronically, we use something called ICD-10 codes, and those are like the codes that the medical doctor gives a diagnosis. So if somebody has like a stroke, that's a specific ICD-10 code. So I would have to document that. And then we also use CPT codes, which are specific to screenings, evaluations, assessments, and interventions. So basically whatever we're doing with the client has to be coded and documented. So I'm still trying to get used to everything. I've only been working here for about 8 months, so the documentation is probably the hardest thing for me right now.
Now, Allie, when did you graduate?
So I graduated about 10 months ago from my OTD program. But prior to that, I got my bachelor's degree from a 4-year college. And I just had to take the prerequisites for occupational therapy graduate school.
Okay. And then once you graduate the OT school, what are the steps in order to be a practicing OT?
Okay, so, well, we're in New Jersey, so it depends on the state, but for any OT, you need to pass the MBCOT exam, so that's the board exam. And then you have to get licensed by the state, so I got licensed by the state of New Jersey. And yeah, that's all I really needed.
Okay. And then once you're an OT, do you keep learning and then keep doing new things in order to learn more?
Yeah, so you can take continuing education courses, like CEUs, that's what those are called. In New Jersey, you actually don't have to, but some companies will require you to do that. Here, in the inpatient setting, it's not required.
All right, I'll see you later, Tony. All right, take care. Have a good one. See you tomorrow. Okay.